We have all grown wary of COVID-19, but we can get past this pandemic phase of the disease faster by taking the available vaccines developed to protect us from serious illness and death. So come on, Jamaicans, get your COVID-19 vaccine now. I'm Adrian Atkinson. Thanks for joining us as we journey through the pages of another informative edition of Jamaica Magazine. Today we'll explore strategies for rebound and expansion of tourism post-COVID-19. And still to come, plastic garbage separation and how you can help. Stay with us for these and more interesting features after this important message.
The following is brought to you by the Office of the Prime Minister.
I'm saying to every single Jamaican, you will decide how this pandemic ends. If you wear your mask, if you maintain the physical distance, and if you decide to take the vaccines when it is your time, the pandemic will end. But if in frustration or just ignorance, we do not take responsibility, then the pandemic could end badly, including the loss of more lives.
The proceeding was brought to you by the Office of the Prime Minister.
Jamaica's top foreign exchange earner is rebounding from the COVID-19 pandemic as the Ministry of Tourism pursues its strategy for bouncing back and growing the industry post-COVID-19. Learn more about the plans in this next feature.
Unprecedented times call for unprecedented moves. With a $1.5 billion loss to the tourism industry, government has adopted an age-old business strategy to engineer a rebound of Jamaica's #1 foreign exchange earner.
The strategic framework for resetting Jamaica's tourism will be guided by the Blue Ocean Strategy, which will allow us to meet our growth targets of 5 million visitors, earning $5 billion, and to provide 5,000 new rooms by 2025.
Economists have for years touted the benefits of the Blue Ocean Strategy. This business model is about creating and capturing new demand in non-existent areas. It is establishing new markets to the point of changing the desires of consumer demand. This act can differentiate a player in an industry and eliminate the competition. This is the current strategy of Jamaica's Ministry of Tourism to reclaim and exceed what it has lost during the pandemic.
A Blue Ocean Strategy calls for the creation of business models that depart from the traditional models based on head-to-head competition and gaining market share. Instead, it will see our ministry pursuing enhanced value creation through production differentiation and diversification.
The Tourism Ministry is known for developing innovative responses to crises, which often garner global recognition. The Tourism COVID-19 Resilient Corridor Program, established in the height of the pandemic and allowed for controlled movement within tourism-dependent locations, received commendations from the UNWTO. The moniker Gen Z Traveler, coined by the ministry to describe vacationers whose experiences and expectations have been shaped by the health and safety risks of the pandemic, is being used by international stakeholders. The Tourism Ministry expects that its Blue Ocean Strategy will receive similar accolades and reap tremendous rewards for the island.
It will require a shift in the mindset as we seek to uncover hidden opportunities in the tourism industry amid the COVID-era economic crisis.
The implementation of the Tourism Blue Ocean Strategy consists of a 6-step plan: expanding markets and go-to-market channels, developing new tourism products, expanding tourism community focus, maximizing linkages across all local industries, promoting resilience and sustainability, and providing destination assurance.
This new strategy, the Blue Ocean Strategy we're talking about, is focusing now on how to build the capacity of the Jamaica economy to supply the goods and services that the industry needs, and in so doing reduce the outflow of dollars into other destinations.
Only 40 cents of every tourism dollar is retained in the country, while just 20% of tourism agricultural demand is supplied locally.
The study that we have done so far indicate that agriculture, just for fresh fruits and vegetables alone, has a demand of 67 billion Jamaican dollars. And on the manufacturing side, there is a demand already established for $360 billion.
To plug the gap, the Blue Ocean Strategy will focus on expanding the work of the Tourism Linkages Network. Committees and working groups have been formed to work closely with resorts and hoteliers.
In this new Blue Ocean Strategy, we are going to change the production and consumption patterns of tourism in favor of a heavier level of retention of the US dollar in the Jamaican space, and in the process create more jobs. This resetting of the industry is to broaden its scope and activities, to enable a wider breadth of employment opportunities, and also to expand the variety of skill sets that are attendant on tourism activities. It is to make the world and Jamaica understands better how a real tourism economy can in fact be structured, and why is it that tourism remains the most critical restoration action that any economy can embrace.
It's absolutely critical that we receive the vaccines. You will see hospitalizations and indeed deaths likely come down. And so there is a lot of value to be gained by getting as many vulnerables on board as possible. So tell your mothers, tell your aunts, listen out for yourselves if you're over 60, and take the vax, because the vax is what will help you to guard against the COVID virus, and indeed help your relatives, your friends, those who you come in contact with, for the same benefit.
Cancer, a tumor or medical condition depicted by abnormal growth of cells in the body. It can be prevented by controlling the chemical balance and toxins within our bodies. Learn more on the impact of foods on the risk of developing cancer in our next feature.
We must exercise. We must seek to eat the right portions of the food groups that these studies have shown are important to a healthy body. And healthcare in Jamaica, I think, needs to shift somewhat away from the challenges of curing ailments to the challenge of preventing.
And as Jamaica moves to balance its disease prevention interventions with the curative aspects of healthcare, Jamaicans must explore the role that the foods we eat can play. Nutrition does play a role, both as a risk factor and as a tool for managing diseases such as cancer.
Essentially, cancer occurs whenever one of the cells in the body decides that it's going to misbehave and not listen to any instructions at all. And so it just grows and grows and grows and doesn't listen to the regular body signals to say, this is how you should behave. So it's really a misbehaving cell which proliferates and grows, and it then becomes a misbehaving tissue.
And what you eat or not can make a difference in how your body's cells behave.
The fundamental control systems in your body are all chemicals, and therefore the chemicals that you put in your body comes from food. So if there is any mismatch or which can occur, one can end up with having what we call a risk of cancer.
Doctors say that a typical diet for most Jamaicans, with its huge servings of starchy foods like rice, flour, yam and banana, with only small amounts of vegetables, does not provide the healthy benefits that can come through a diet. Instead, doctors suggest eating more fruits and vegetables rich in fiber and antioxidants, and fresh foods high in calcium and vitamin D. Fat-related chemicals are among those that tend to promote cancer, so diets that are high in fat create more of a predisposition to the disease. Alcohol can also have a negative impact.
We say you should not smoke. We also say that you should not consume alcohol if at all possible. The equivalent of an ounce a day is perhaps the limit that we'd allow.
Of course, there are other things not in our foods, found in our environment, which can cause you to get cancers, including toxins such as asbestos. But our focus here is on the role of what we consume, particularly processed foods, which doctors agree should only be eaten in minimal amounts. Some processed meats, for instance, have been linked to things like the propensity to develop colon cancer. To lower the risks, nutritionists recommend fresh meats that are broiled, baked, or steamed to get rid of the excess fat. Nutrition is seen not only as a means of prevention, but also part of the treatment for diseases such as cancer. Patients with cancer are often given specific nutrition interventions as part of their treatment regimen.
So apart from the specific surgical procedure you may have, or the radiological procedure that you may have, radiotherapy, or even the chemotherapy that you may have, nutrition also plays a role in you surviving your therapy.
In striving for a healthy lifestyle, which includes eating well, it's important to maintain physical and mental fitness. Fit individuals engaging in physical exercise at least 3 times per week are more likely not to have any of the chronic, non-communicable diseases such as cancer.
You should engage in at least 3 bouts of physical activity, at least 30 minutes for the day, moderate walking at minimum or the equivalent. You should have to be as stress-free as possible, and you should aim to achieve your ideal body weight. So those factors would generally lead you to what we consider to be a healthy lifestyle, which will tend to protect you not only from cancers, but also other cardiovascular diseases like diabetes and hypertension.
Disease prevention should be our priority. So let's all make our food our medicine and our medicine our food. It's everybody's business.
It's the 11th staging of the JIS Heritage Competition. Students, show your national pride by entering the essay, poster and photo competition. Primary school students, enter the essay competition. Triumphant, proud and free. Use this phrase from the song Jamaica Land of Beauty to explain our nation's heritage and achievements. High school students, design a poster that best portrays the phrase triumphant, proud and free. And university students, capture a photo that depicts the phrase triumphant, proud and free. Haven't sent in your entries yet? There's still time. The competition has been extended to November 7. Visit jis.gov.jm for guidelines. Triumphant, proud and free. The JIS Heritage Competition 2021.
Private medical practitioners and medical facilities are now partnering with the Ministry of Health and Wellness to administer the COVID-19 vaccines. It's the state's latest intervention to make it even more convenient for persons to access the vaccines. Take a look.
We had said some time ago that the response to COVID had to evolve over time. And we're trying to move the process to the next phase. And today, I think, is a good occasion because we now are in a position to add outlets to the vaccination opportunities that are available. So we have gone through a process of advertising a request for proposal or RFQ. We have received a number of proposals. Those proposals had to conform to requirements that were established. They basically, those who are here and others, have said this is what we can do, this is how we will do it, and this is what it will cost to get it done. And having reviewed that, the first group of individuals or entities numbering 11, have been selected for this private-public partnership for vaccination. We're very proud of the team that is here, the persons, the entities that have been selected. We believe that they are very qualified, technically and otherwise, to be a part of this process, and we are happy to partner with them in a way that allows the public health infrastructure, the public health technocrats to provide some oversight to ensure standards are maintained, but nevertheless giving these entities the autonomy sufficient to inoculate. It's a simple process. We provide the vaccines free. We will help them to promote their locations. People go there or make appointments and they get their vaccination. First dose, second dose, as the case may be, and they will have the capacity to collect their dosage in a time period that allows them to store safely, and of course all the other supporting equipment, the observation that is necessary, all the things that we do at the national arena or the other locations, these entities will have to comply with it. So it's not a different system. It's the same system, same standard, but additional outlets. And these entities would have met those requirements. When the public access these vaccines, the government has a contract with these entities to allow them to recoup their administrative cost. The vaccines are free. The government has already paid for them. And the service to the public is free. That's very, very important. So Jamaicans now have more outlets. Let me just go through quickly what the requirements are of the entities. They are to counsel vaccine clients about the COVID-19 vaccine before vaccination. They are to do observation post-administration of the vaccines. They are to have systems and protocols in place to handle possible urgent adverse events following vaccination, and to secure sufficient quantities of vaccine associated with supplies such as personal protective equipment and specialized storage equipment, and to maintain a steady supply stream for the delivery of the services. All that we would require of the public health infrastructure would be required. In addition, they are to maintain vaccine records and documentation, as well as to provide a completed Ministry of Health and Wellness COVID-19 vaccine card to every vaccine recipient, and to dispose of waste associated with the service.
This is an innovative and bold step that is being taken to get as much of our population vaccinated in the shortest possible time. On behalf of Bay West Wellness Hospital and Clinics and the partners present here today, I am excited at this opportunity that has been provided to us to participate in private provider vaccination program. Minister Tufton, you can rest assured that we continue to stand beside you in the fight to rid our shores of this scourge.
Today for us marks an important development in our efforts to vaccinate at least, hopefully more, but at least 65% of our population, hopefully before, but at latest by March 2022. And this, of course, is in pursuit of herd immunity against COVID-19.
The government of Jamaica and its partners invites you to be part of the 7th Regional Platform for Disaster Risk Reduction in the Americas and the Caribbean, November 1 to 4. Tune into this station and watch the opening and closing ceremonies, as well as select sessions on the Ministry of Local Government's Facebook page, the JIS website and YouTube channel. Hear how the region is building resilient economies in the Americas and the Caribbean, for you, for now, and for the future.
Recycling is an important component of solid waste management. The National Solid Waste Management Authority has kick-started a plastic garbage separation project in Jamaica that will not only support this but also help reduce harmful pollution. Learn how you can be a part of this next.
Jamaicans will have to undergo a behavioral shift in their solid waste disposal practices and get into the habit of sorting their plastic waste, which could potentially save the country millions. If the National Solid Waste Management Authority has its way, within the next 2 years, every household will have to separate its plastic for garbage disposal. According to the state-owned agency, approximately 40% of domestic waste consists of solid degradable substances such as plastics.
When it goes to the landfill, and should there be a fire, those plastics enhance the burning and give us less control in managing any event of a spontaneous or otherwise fire at the landfill.
We have two types of waste in the household. You have the organic and the inorganic waste, and the plastic is part of the inorganic. So it is a very good initiative, and I believe that it will save us money and it will save us the environment.
Research has shown that plastics harm the environment, impacting the growth of humans, flora and fauna. Plastic products are known to clog drains, contributing to year-on flooding. Plastics also pollute the seabed, damaging the ecological system, such as sea creatures and mangroves. For those reasons and others, the NSWMA has embarked on a plastic separation project for Jamaica. Now in its pilot phase, the project has kicked off in Kingston and St. James.
The purpose of this program is, one, to rid our waste of the plastics. Two, to reduce the amount of plastic that goes to our landfill. And three, also educate this community on how to separate and why the importance of separating these plastics.
Our regional office, WPM, is promoting love for the environment, and as you are aware, the NSWMA is an environmental organization, though government. We are interested in the health of the environment, and keeping our environment safe is of importance to us. We want to rid the environment of harmful effluents, like we have plastic bottles.
The residents are first educated on the importance of garbage separation, and then homes are provided with containers to solely dispose of their plastics.
Today we just will be issuing flyers to the residents of the communities. We'll be issuing drums, and we'll just having general discussions with them about how to make their environment more cleaner, safer and healthier. It is important that they separate at source. That way it is much more easier for us to handle the waste and take care of it accordingly. We schedule these collections, right? Once weekly, they will come in and collect, and those plastics, whichever resident is unsure of when the collection date is, they can always call us. We have a mobile app that they can also check with to verify when is their collection day in case they are uncertain.
We were actually approached by the NSWMA, and we were quite excited because we do recognize that there has been significant degrading of the environment. We have been sending emails, we've been sending text messages so that they understand that what their responsibility is in this in protecting the environment and doing what we can to ensure that our children are able to benefit and see the natural resources that we have to offer here in Jamaica and to a wider extent the universe. As far as being a part of this pilot program, one of the first communities to be selected, I mean, it's something that's going to give us a significant boost as it relates to the wider Jamaica, so that people can recognize that the Meadows of Irwin citizens, that we are conscious about what's going on in the environment. And it starts with one person, but I mean, if we could get together as a community and we are undertaking this initiative, then it goes to show that we can go ahead and extend that further within the neighboring communities, and just do great things for our country.
In this pilot launch, the NSWMA has collected more than 1,000 pounds of plastic bottles from not only householders of Irwin, but other communities in St. James, such as Rambo Hill and Westgate Hills, which have since joined in to separate their garbage of plastics. The drive is now to provide more residents with the resources to separate their garbage. Plastics come in various types, shapes, and kinds. Toys, stationeries, personal care items, and the very obvious, drink bottles. The NSWMA has partnered with other agencies to properly dispose of the separated plastics.
We don't use the same units that we use to collect the regular household garbage. We use a tipper, a special truck, to pick up those plastics. So they are not mixed in the regular garbage. So once they are separated at source, we come and we collect on specific days. We also partner with RPG, that's Recycling Partners of Jamaica, who takes these plastic bottles and recycles it.
Some types of plastics can only be composted by industrial or municipal facilities after first being separated from other non-biodegradable plastics.
If you love the environment, you should ensure that you protect it. And this is one way you can protect it. Ensure that you separate your garbage. You have your garbage that you can separate for composting, and you have your garbage that you can separate the plastic from to ensure that it does not end up in the sea in our drains. And if it goes to the landfill, which we are trying to reduce the amount of garbage that goes to the landfill, if it is at the landfill and burnt, then you know that it will give off poisonous gases that can also affect us health-wise and our environment. It can damage the ozone layer, and it can also, through the burning, which would create carbon monoxide, damage our respiratory system.
Do you want to have your community join in on the plastic separation pilot project? Then contact the NSWMA at 876-926-5170 or download their app from the Google Play Store to connect with the agency.
We've come to the end of Jamaica Magazine for today. Be sure to join us again tomorrow for another show. Until then, there is more you can watch on our website, jis.gov.jm, or our YouTube channel. You can also find us on all the major social media platforms and through our mobile app that's Android and iOS compatible. On behalf of the entire production team, I'm Adrian Atkinson, urging you to take the COVID-19 vaccine, wear your mask, keep your distance where possible, wash your hands or sanitize, and do stay safe.
This has been a production of the Jamaica Information Service, the voice of Jamaica.